Hello, everyone, and welcome to our Innovation Institute, our Institute of Online Learning, where we share new webinars and great information with you by the leading experts in the field. So today, we want to bring to you the first of a six-part webinar series about IV nutrition. And today's going to be all about the introduction into IV nutrition. If this is something new to your practice or that you've never done before, we have an amazing presenter today who is going to walk you through just the basis of IV nutrition. And then in the next 5 webinars after this, we'll dig deeper into some of the more detailed rules and regulations, and then also into specific therapies. So today I want to introduce to you a wonderful nurse practitioner named Shaitali Patel. And let me introduce her a little bit more so that we know exactly who is going to be talking to us today. So Shaitali is the founder of Intro CEO and of Vita Infusions LLC. She is a board certified nurse practitioner with over 10 years of clinical and management experience, including emergency and trauma medicine. She is a passionate educator and advocate for preventative health care with an emphasis in the application of IV nutrition in medicine. She is the lead clinical educator for Vita Infusions, assisting professional practices and staff in the training for safe and efficacious startup delivery of IV nutrient therapies. And at the end of this presentation, she will share with you all of her information. So if you're interested in learning more about her program. But hello, Shaitali, and welcome to the Innovation Institute.
Thank you very much, Tara. It's a pleasure and an honor to be here to share a lot of information about IV nutrition therapy. So I appreciate you. Thank you. So let's quickly dive into our topic of IV nutrition therapy. And let's discuss what exactly is IV nutrition therapy. IV nutrition therapy is basically giving nutrition via intravenous method. Intravenous method is usually application of infusion, starting an IV. It's a little catheter in a patient's arm. It's a venous way to give any sort of fluids, vitamins, minerals, amino acids, and anything else that we can actually give parenteral, which is, again, IV. It is one of those methods that has evolved over the last couple years in many practices. As you all have heard, every corner most likely has a hydration bar. Every medical office is offering more IV nutrient therapy. Myself including, we specialize in IV nutrition therapy. So just that's exactly what it is what it's named is IV nutrition through IV mode. So that's exactly what patients come in for is a procedure through IV. So let's talk about our next option as to why exactly do we pick IV nutrition? Why can't somebody do oral nutrition or oral supplements, or why does it have to be an IV route? Well, there's a lot of benefits when a medical professional chooses an IV route for their client or patients. One of the biggest one is that it bypasses the digestive system. Most people nowadays with the American diet, with a lot of inflammatory foods, with a lot of foods that have preservatives and coloring, create a lot of chaos on a gut level. You may be taking high quality vitamins orally, but your patient or client is still not able to reach their highest capacity of production, basically. So we choose the IV route to basically bypass all that inflammatory process, get it directly into the bloodstream, and then optimize all cellular health that way. The second thing, like I had mentioned, it rapidly enters the bloodstream. So when it rapidly enters the bloodstream, people or clients usually find benefits quicker than an oral route. The serum levels, the body levels that is used to operating at certain amounts of vitamins and nutrients, the processes in the body speed up, which means the patient was going to feel better right away. You're also able to give higher than normal levels through IV. There are certain nutrients that you have to be limited to orally. A great example is vitamin C. We do recommend patients take vitamin C orally, but there's only so much patients can tolerate orally. Massive side effects such as GI distress, diarrhea, cramps, very possible with high doses of vitamin C. So the best way to give that patient vitamin C, if need be, is IV route, because then you can get into the 10, 15, 20, 25 grams at a time, which is almost very difficult to get taken orally. So again, you can reach higher clinical value quickly. Immediate therapeutic response by their system. A lot of people, again, when we go back to that gut, when it's inflamed, it's not absorbing well, things of that nature. A lot of people suffer from nutritional deficiencies in that manner. A lot of nutritional deficiencies can kind of mimic a medical condition, sort of a diagnosis these patients get slapped with. But the simplest way, really, is to figure out if they really have a nutritional deficiency that's causing those symptoms. So we always start with the basic, and there you go. Nutrition is definitely going to be one of those building blocks to better health. Okay, so in the next way, let's talk about what are the bad, with every good comes bad. So what are some bad or negatives that we have with IV nutrition? Well, first of all, a lot of people are not just going to give you arm and say, all right, here you go, stick a needle. There's always fear of needles, which a lot of majority of my clients have. So you may have a client that doesn't necessarily want an IV. They're very gung-ho about the benefits. They're very gung-ho about immediate results. But when it comes to how it's administered, that may be a determining factor as to whether the patient will sign up for a treatment or not. So fear of needles, definitely. Discomfort when getting an IV needle inserted, the thought of watching a practitioner stick you in the vein, again, is not very comforting. So that may deter one person to sign up for an infusion. There are risks associated with infusions or IVs. Number one, and which is top of the list, as you all know, is infection. So therefore, we have to be very careful that we have trained personnel administering the infusion. They're following clean and aseptic technique. But if you break that technique, one of those, again, repercussions would be infection. Allergy is another. It could be anaphylactic or a simple just irritation to the vein. That can be very uncomfortable. You can also have an infiltration of the IV, which means that the IV catheter somehow slipped out of the vein, the fluid or the product that you're injecting leaks out into the tissue. That can cause a lot of damage depending on what you're infusing. So those are some risks. And then sometimes, not everybody is a candidate to start an IV. Not everybody has great veins. If you have patients that have certain conditions such as cancer or chronic dehydration, certain autoimmune conditions, getting IV access can be absolutely difficult. So that's another kind of a con, I would say, for IV therapy. The biggest I see in my practice is the out-of-pocket expense with infusions. Currently, it's not covered by insurance. A lot of it is cash pay. So that is another determining big factor as to why clients will not sign up for IV infusions, is the cost that's related to treatments. Moving forward, let's see, we have, why would you pick IV? A lot of people come to me and say, Chai, if it's really that expensive and patients don't like needles, why why do IV? Why IV route? Again, the benefits are unbelievable. Once you get them IV route, the cellular function improves. And that's what causes people to feel good immediately, whether the goal is detoxification or treating nutritional deficiencies or a particular symptom. Let's say, for example, you're treating chronic fatigue, right? Somebody comes in here, gets an IV infusion, feels better immediately in 15, 20 minutes. They're more likely to come back for another treatment because you're able to make them feel better right away. Improved cognitive function, again, we all know our B vitamins support neurotransmitter work in the brain. So if you're dealing with anxiety, depression, and they're able to feel bright again or better right away, again, more reason. That's another health benefit of taking it IV versus oral. Improving healing and surgical procedures is definitely big on the list right now. It replenishes the body from recovery of injury and tissues. So, that's where we start looking at people that, For example, the athlete world, they perform strongly, come back. They definitely have muscle and tissue injury when they are performing at their best, and you definitely want them to replenish quickly. And one of the fastest ways is IV. Hydration recovery for most patients is also great when it comes to a lot of people that are in constant state of dehydration. A lot of people think they drink a lot of water, but you will be surprised how many people don't drink enough water. I know there's a rule of thumb that keeps going out there that says, your body weight, divide that by 2, and that's the minimum amount of ounces you should drink a day. And most people say, well, I drink that. Well, no, that's the minimum. So you want to drink at least that, and if not more. If you're taking certain medications, certain supplements, again, if you're doing IV nutrition therapy, the requirements for hydration increase. So that's another topic on another day, but definitely best way to get it there quickly is through IVs. And of course, stress relief. We all live in a world with a lot of stress nowadays. And I think the best way we can all handle stress is, again, vitamin C, IV infusions, and those are some of your health benefits that we can go over. Moving forward, I think one of the biggest statements for this topic would be the immediate results that clients and patients see. You've seen a lot of clients probably in your practices that have come from other practices that are probably not very happy with the results because they don't see them immediately. We live in kind of an era where patients want to see immediate results. And again, fastest way is going to be through IV because you can get that serum level up and you can give them a little higher milligrams or dosages of vitamins, nutrients, aminos, higher than what they can handle orally. So that is going to be the biggest highlight for IV nutrition is immediate results from somebody who's come from multiple practices to you with complaints of different natures. Also keeps the compliance rate for patients slightly high. If people feel good right away, they're going to come back for another treatment. Most people that don't come back for any sort of treatment is because they don't see results that they want to see. Now, granted, the timeline differs from a provider's perspective and a patient's perspective, but when patients see those, they're more likely to adhere to treatment plans from that provider's office. So, what are some health conditions that help with, what are some conditions that as a practitioner you would say, okay, this is something that will benefit me. This is something that I can actually add to my practice. Why should I add IV nutrient to my practice? What are what is the clientele that I see that can benefit? So let's go through that. It's a vast list and there's no particular order. There's no particular written in stone, this is it and this is not. You can almost treat any condition with IV nutrient therapy. The biggest ones, are on top here. That's chronic fatigue. Almost everybody who walks into your office is absolutely tired. Now, whether their reasons are from adrenals or nutritional deficiencies, that's for the provider to kind of sort and work them up to. But that is one on my list that is huge because when people are tired, they can't function and they want to be able to perform and function at their highest. So that's definitely on top of my list. Chronic depression, insomnia, and anxiety. Another really big one. We are in the world of COVID, a lot of unknown. We've been battling the condition for about a year now. There's a lot of patients that are going to be facing some mental health illnesses. We've already started to see a few of them come in constantly with complaints of insomnia, anxiety, depression, not really knowing where we're going, what's going to happen, childcare, financially. So all those contributing factors to mental health are going to be bombarding us soon. And again, IV nutrient therapy is a great tool in your practice to offer for such conditions. Sexual dysfunction, a lot of people, if there was any, weight loss, I believe sleep and sexual function, I will tell you, those are the 3 top. If you can get that combination correct, I think that, all of us would be doing our patients really good stuff. But top of the list again, sexual dysfunction definitely helps with that. You've got nutrients which are like very beneficial in patients that can't use a whole lot of medications. Again, IV nutrient therapy becomes extremely helpful in situations of that sort. You know, somebody has a cardiac condition, can't use Viagra or any other kind of a, pill, then we definitely have protocols and ways that we can enhance their sexual function through IV nutrient therapy. Acute and chronic pain, fibromyalgia. As we all know, we have a pain pandemic going on as well. We've had it for several years. A lot of people resort to Lortab, Percocet, things of that nature, but there are surprisingly integrative ways to treat pain, and IV nutrient therapy definitely has protocols to treat chronic pain or acute pain and conditions such as fibromyalgia. Migraine, tension, headaches, seasonal allergies, um, food sensitivities and allergies also kind of sort of fall into the same category as allergies for me. Again, top of the list, respiratory issues, especially in the COVID area. I think that's a big one. Autoimmune disorders, as you all know, Hashimoto's is one example. There's very many more that follow through. In the autoimmune world, once you have one autoimmune condition, most likely most people throw to you a statement that you might likely have more than one. So again, very helpful with autoimmune conditions, oncology conditions, obesity, diabetes, hypertension, all big areas to treat, not only from a preventative way, but also from a management way. You may not have people coming in with such conditions currently at your practice, but if there is a way to use them as a prevention, IV nutrient therapy is definitely a great tool, again, for your practice and for practitioners to support those conditions where they can prevent a lot of those conditions happening in the future for their clients. So what are some proactive approaches? That's what we talked about on our last slide is if you have tools in your practice to treat patients prior to getting a condition, why not use that tool? It's extremely effective to boost your immune system and definitely effective to boost your nutritional status, also prevent illnesses. It's very important that we all have a tool during the flu and viral seasons. We're about to enter a very difficult, hopefully not too long flu season with the COVID variant and all of those other things that are happening right now to us. And again, IV nutrient therapy can provide a lot of the solutions for your clients and for yourself to keep you healthy through those seasons. It's also important before, during, and after stressful situations. So again, travel is one of them, surgery is another, definitely multiple uses. Definitely consider offering your clients IV nutrient therapy before a situation that they're going to enter. So, we have a variety of situations we support: weddings, life-changing events, deaths in the family. Of course, you can't control that, but definitely offering some sort of stress support for patients that are going through stressful situations. Travel has become stressful, believe it or not. So you want to offer your immune boosters and immune IVs, if possibly can, to your clients that travel either nationally or internationally. So another good tool for practitioners is to offer these sort of immune boosting IVs when their clients are traveling. So let's talk about the biggest question, determining frequency. That's like the $1,000,000 question. How often do I get these infusions? How often do I come see you? What exactly, how do you determine frequency? And a lot of practitioners kind of, they struggle with that question. And you have practitioners that overdo it, and then you have practitioners that underdo it. And for a variety of reasons that, and one of the reasons that I've heard from other practitioners may be cost. Cost sometimes absolutely determines the frequency of your clients coming in for infusion. So there's no real golden answer to frequency. I definitely encourage practitioners to have a good relationship with their pharmacists or their compounding pharmacies during this question. The reason being is they're about to, start a protocol. First questions, how often I come, speak to your compounding pharmacies about, what is their take in terms of kidney clearance, or how long the vitamin or mineral or amino is in the patient's body before, it clears completely out, dosages. those questions answered by your compounding pharmacy and your pharmacist is going to determine frequency. So they also may help you with what nutrients are compatible, what treatments are compatible or not compatible, what fluids are compatible, what fluids are not compatible with others. So somebody's going to look at me and say, well, Chai, everything's compatible. No, not exactly. Let's talk about fatty acids really quick. Just a quick example. When you're infusing fatty acids, one of the solutions that you possibly should not use is normal saline. One of the reasons is that fats plus salt will create soap in the body. So if you're trying to give somebody a protocol with normal saline in addition to a fatty acid infusion, you might want to split up the days. Probably not a good idea to combine. Again, you have compounding pharmacy, and pharmacists will support you with those decisions. The other thing that determines frequency is what is the end goal for your patient that's using IV nutrient therapy? Is the end goal resolution of a symptom? Is the end goal resolution of a nutritional deficiency? Is the end goal management of a condition, such as oncology conditions, autoimmune? Is this condition lifelong? Is this condition going to be something that we need to manage lifelong and it never goes away? So those are some of the questions that will help you determine frequency. Frequency can be once a week, twice a week, 3 times a week, 4 times a week possibly, or even 5. Now, somebody will say, how can you possibly do IVs every day? Well, example again, NAD infusions for addiction treatment. Those infusions are close together. Multiple infusions have to be occurred together to reach the goal. The goal is to help the client with addiction problems. That is a protocol that needs to occur very close together in order to keep the serum level the same, and so that we can actually get to the goal of helping this client with the addiction of whatever sort that they're treating. Most providers will jump in and treat addiction from a different angle, but that is one very common protocol that clients do almost every day, very stringent for a week or 2 or 3, depending on their physician's treatment plan. So don't hesitate to ask your pharmacist. Don't hesitate to create a plan that works for your client. Don't hesitate to put a goal in place for your clients to say, where exactly are we going to this goal? If the goal is met in 2 weeks, we back off, then that's a good plan to have with your clients as well. So again, golden question, how quickly, how frequently do we come back? That's going to be determined by a couple different factors. And once again, I can't stress the relationship you can have with your compounding pharmacist or pharmacy to help you with those areas. So what are some wellness uses of IV? We talked about all the heavy and hard conditions that we possibly can treat, but somebody who doesn't have anything going on, let's say, I'm coming in, I'm interested in IV nutrient therapy, what can it do for me? Well, there's tons and tons of anti-aging protocols out there, wellness protocols out there from an IV infusion standpoint. One of them is detoxification. We live in a very toxic world. We come in contact with a lot of toxins, cleaning supplies, cleaning material. We inhale a lot of toxins. We also put on ourselves a lot of toxins. We're talking about makeup and perfumes and scents and nail polish. We're basically a walking toxic burden. So it's recommended that for a wellness perspective, if you can find a detox package or a detox infusion therapy, that would work very well to reduce the toxic load, which, in return prevents a lot of chronic conditions. Energy boosting, promoting weight loss, and then treating nutrient deficiencies. Again, it comes back in the wellness arena. Somebody may have a nutritional deficiency and not necessarily have a major condition. So they can do it for wellness in that sense. An example to treating a nutritional deficiency is somebody who comes in with complaints of muscle cramps, okay? It's a symptom. Most likely, a lot of you could probably point, what would you give to a client that comes in with that? Well, magnesium is a great player in treating cramps, which is a direct result of a nutritional deficiency of mag. So again, that's another wellness way. And anti-aging, everybody wants to look young, and we want to kind of slow time down. So those would be your wellness applications to IV nutrient therapy. You can definitely in your practice promote both wellness and medical infusions. As far as clients and patients are concerned, I think they need to find a good fit or a good provider. If their complaints geared more towards chronic conditions, then find a medical infusion practice. If you are okay with getting wellness services, then find a practice that does very well with wellness services. Either way, I think that having more knowledge on IV nutrient therapy, the nutrients that you're infusing, where to get those nutrients from, and what kind of relationship should you have with your compounding pharmacist is extremely huge. Now, just to real quick, we don't have a slide on this, but I do want to add on here. It's very important that as practitioners we pick the right nutrients or aminos and vitamins for our clients. What are some of the differences? And this is a question I get during my training sessions all the time. Why pick a compounding pharmacy and not McKesson or anything that's manufactured already for you? Well, I know that, when we treat certain conditions, a lot of people come in with a lot of different issues, one of them being inflammatory issues. Using preservatives is probably not feasible for my medical infusion patients, as well as dosaging. So the quality, I believe, that comes from a compounding pharmacy may be deemed a little superior than the quality from a manufacturer. You want to think of this in terms of personalized and customized medicine. You have a one size fits all strategy with manufactured compounds, but you have a more customized and personalized option with compounding pharmacies that are offering injectables or aminos or vitamins and minerals. So something to really think about when you're choosing product for your clients. Again, build your relationship with a compounding pharmacy. Pick a pharmacy that can help you customize, personalized clients. We are headed towards a personalized medicine era, and I don't think the one size fits all sometimes works for everybody. So I hope you have a good conversation with your compounding pharmacist and come up with a plan that works for your practice. So that brings us to our conclusion of what our first series was, is IV nutrient therapy. I appreciate everyone that's tuned in to listen to this little seminar. Stay tuned. We're going to come back with our second series, which talks more in depth about regulation and safety.
I hope that you got some great takeaway information and learned something new that you can put into your practice today. The Innovation Institute was designed to provide you with the tools and education that you need to help grow your practice and increase your knowledge base. If you enjoyed this lecture, I invite you to continue learning by signing up for the next webinar in our online series. To do so, please visit our website at www.innovationcompounding.com. As always, the pharmacy team at Innovation is here to answer your questions and listen to your feedback. So please reach out to us at any time. Again, thank you for listening and be well.